More Americans are surviving cancer than ever before, a historic milestone, by the way. But new numbers show why the fight is far from over. Record survival rates, rising diagnoses, and who's still being left behind. The report from the American Cancer Society says 7 in 10 Americans diagnosed with cancer are now expected to live at least 5 years, the highest survival rate ever recorded. And cancer death rates have also dropped by more than a third since their peak, translating to millions of lives being saved. However, the agency also projects more than 2 million new cancer diagnoses this year. That's nearly 6,000 people every single day. So let's look at what these new cancer stats really mean and how they impact families right here at home. Glad to have Dr. Kristin Higgins here with us this morning, radiation oncologist and chief clinical officer for City of Hope Cancer Center here in Atlanta. Glad to have you here. So let's start with this. Why are the survival rates improving so dramatically? What's causing this?
We've made so much improvement over the last decades, and many of those improved survival rates are related to improvements in therapies, new drugs that can fight cancer. If we think about lung cancer, we have immunotherapy and targeted therapies, and those have all come to fruition because of clinical trials that patients have participated in over the last decades. So that's one thing. And another major thing is screening. When we screen for cancers, we're able to detect cancer at an earlier stage of disease. If you're diagnosed with a stage 1 or stage 2 cancer, you're much more likely to be cured relative to a stage 3 or a stage 4. So I think it's improvement in screening, and then the drug development that has had such an impact on a number of cancers across the board.
And Dr. Higgins, how different is cancer treatment today compared to, let's say, 10 years ago?
It's so different. I tell my patients the cancer treatment for you today is not the treatment that your grandmother went through. It is so much less toxic. For example, radiation therapy, the side effects are much more tolerable. Many of our patients are going through working every day, fitting their cancer treatment in and maintaining normal lives. And that's really what we want. We want our patients to be able to fight cancer, but continue to live a full life with their community.
You know, and how often do you see cases where earlier screening, people coming in earlier, could have changed the outcome?
I see it every day. I want to double down on lung cancer, for example. Only about 10% of patients who are eligible for lung cancer screening in Georgia are getting a CT scan, and that can save lives. It's so important that if you are a patient, that when you go to see your primary care doctor, ask them, am I eligible for screening for lung cancer? Am I getting all of my screening studies? It's things like mammograms, colonoscopies, pap smears, CT scans. These are all the tools that are really going to further improve upon these survival rates that we're seeing.
Yeah, it all really does matter. And how much does perhaps geography, where you live, affect the cancer outcomes?
It continues to affect outcomes, unfortunately, and it's all about access. There are people living in our state that don't have access to primary care physicians, people that live in more rural communities that can't get out there and get those screenings. And that's where we really need to double down the efforts. And we need to bring screening to these patients, screening vehicles that go out to the community and help these people get these studies that they need to diagnose the cancers that could be there that they don't know about. It's about education as well, educating people about the importance of prevention, and also about lifestyle modifications that we can make every day to reduce our risk of cancer.
Yeah, and Dr. Higgins, what keeps you optimistic as an oncologist, even on some of the hardest days?
I think seeing the way that patients and their families really rally around a patient when they're diagnosed with cancer to get them through their treatment, even though it's a resource-intensive treatment to come for radiation therapy every day and chemotherapy, I just love seeing the way that people are so giving, donating to the cause. At City of Hope, we see a lot of generosity when it comes to rallying around our cancer patients.
Mm-hmm. I'm grateful for the work that you and so many of our doctors do. Dr. Kristin Higgins, thanks so much for joining us this morning.
Thank you.